É o fim da ladeira, é a viga, é o vão, festa da comida. É a chuva chovendo, é conversa ribeira passada.
I want to hear more of it, Julia. You can't tease me with just a few seconds.
É a mastradeira, passarinho na mão.
That's the Waters of March in Portuguese, from Brazil, from Jobim. Anyway, we move on. You're listening to the Lisa Wexler Show. It's 5:07. Well, there's news from abroad, and none of it's good. None of it's good. And so we've been talking about radiation and cancer and tsunamis and earthquakes and things that are not within our control. And then, of course, there are the other things that are not within our control, which is how our body develops in disease and illness and the things that beset people every single day of their lives. And we certainly hope that there aren't going to be people that are going to get cancer from the radiation in Japan. It was interesting yesterday when I was in the studio and Lucille called to talk about the fact that she'd been treated with radiation for her cancer, the irony of too much radiation causing cancer, and yet radiation being a treatment for cancer. It's very powerful, radiation and heat and all of that. That energy source is so powerful. It has to be calibrated to the such nth because the body can't take too much. Otherwise, our bodies turn against ourselves. Well, there is a person who started an organization called Gift of Life, born out of his own illness, and we're going to be chatting with him in a few minutes. But here in the studio, Maxine Braten from Wilton is here, along with her dear friend Shira Friedman, who actually brought this case to my attention. Maxine was recently diagnosed with something called MDS, and the long name is Myelodysplastic Syndrome. Is that right?
That's correct.
A form of blood cancer. And the long and the short of it is that she needs a bone marrow transplant. She needs it quickly as possible. She's a mom of 2 young girls, as well as a sister and a daughter. And what she found out, which is so disheartening and shocking, frankly, is that there are a lot of well-meaning, wonderful people who have donated bone marrow, but the $54 test that is necessary to find out if it's a match is another expense, another hurdle, so that a lot of those bone marrow tests have not, in fact, been tested in order to find out if you have a suitable match. Is that correct, Maxine?
That is correct.
I mean, that's just the heartbreak away. It's just impossible to believe when you recognize the costs involved in saving your life with a bone marrow transplant dwarf testing all these samples.
That's correct. They could just be sitting there right on the table, right in the lab. Just my match could just be sitting there and not being tested because of the financial aid that's needed.
So I've opened up the phones to begin this discussion. 203-845-3044. Jason is on the line, and we're going to talk to Jason. Jason, tell us your experience with bone marrow transplants.
Well, Lisa, my daughter, who's now 6, 2 years ago was diagnosed with aplastic anemia, which people always think I think that people have to remember when you have a bone marrow transplant, they associate it with cancer, leukemia, or something like that. But that's not necessarily the case. My daughter has a blood disorder, which caused her bone marrow to fail. And 2 years ago, or 2.5 years ago, she actually had to go through a bone marrow transplant procedure at Boston Children's Hospital. And when you tie everything in, I'm listening to your show, and it's funny because the amount of radiation they gave her would have killed a man in 2 days. Well, when they give these kids, what I found out in the hospital, my daughter was lucky enough she didn't need something that severe, but she went through maybe a 5-minute zap, and the way the doctor explained to me was that if it happened to me, I could have gone to work that same day. And just felt a little side effect. But I think the important thing that people have to realize is bone marrow transplant, you don't get pricked to get tested. It's a swab in the mouth. It's important. And one thing that's also unique, certain races, like I'm from Asian descent, they don't donate bone marrow.
Why?
Part of it is superstition because they feel that if they donate the bone marrow, part of their spirit goes away or something. And it's important because my daughter's 5 years, was 3 years old at the time, and they normally don't take young female donors because I believe something about giving birth and it's with the way they take it out and it affects the way they give birth or something. Something was explained to me like that. My wife and I was very strong saying we need to at least be as close as we can on the race, just in case of other diseases or whatever. And believe it or not, we were very fortunate that a woman in Taiwan gave her bone marrow, a young woman gave her bone marrow to be the transplant for Victoria.
And she didn't know you or your family, just as a goodness, just as an altruistic act.
Exactly. I mean, and I had blood drives for my daughter, the YMCA, and there's actually a bone marrow group that comes down and tests for you, and will pay that $54 for you.
Maybe that's Gift of Life. Maybe that's the group we're talking about today. No, they're saying no, it's a different one. But let me ask you this. You say it's just a cheek swab. That's to determine the match. But then after that, there's obviously procedure involved in donating bone marrow. It can't be as easy as all that. It's got to be a little bit painful to the patient, right?
From the patient, from what I understand, it is. It's a little thick, and I don't exactly know the whole...
All right, we'll find out from the doctor at 5:30. Go ahead, Maxine.
I can tell you what is. Actually, what they do, the higher percentage these days is it's just like giving blood. They don't... What they used to do is they used to put the donor under general anesthesia, and they used to go into the hip bone, which is more like your lower back, but it's the hip bone, and they used to poke around anywhere between 20 to 25 times to get enough samples of bone marrow to then transplant into the recipient. These days, the majority is done where the donor's just sitting there. They're taking blood out of one arm, just blood, just like you're donating blood. It's going to go through a machine, and it's going to come back into their other arm on the other side, and that's it.
Well, what do you mean? I don't understand.
It's just so what the machine is doing is it's taking out, the bone marrow, the peripheral cells, the cells that are still bone marrow, and they're taking it out. They're cleaning it out of that person's blood, and they're just going to take that and now put it into the recipient. They don't have to go through the hip as much anymore. So it's virtually painless, except for the little prick in the arm, like as if you were donating blood.
I didn't know that. So
yep.
You're telling me that blood has bone marrow in it.
That's correct, peripherally.
But enough in order to be able to replicate and duplicate and help another person.
That is correct. So you can save a life by almost basically just donating blood.
I had no idea.
But what they have to do first is 5 days prior to their donation, they need to take these injections that are going to build up their cell count.
Okay.
And then, which some people say, like, you might get flu-like symptoms. I just had a friend 3 days ago. Her brother just received a bone marrow transplant 3 days ago, and the sister was his match, and she said she felt nothing.
She felt nothing.
She flew home.
Okay, so if you're basically healthy, chances are you won't get it. But if you do get it, it's a cold sort of thing and it goes away?
Yep. Just
That's
like a few
unbelievable.
Days. It's like flu-like symptoms and it goes right away.
Jason, did you know this?
Didn't know that part. When from a parent point of view, all I know is when you think of getting the bone marrow, it's almost anticlimactic on the way they do it.
Yes.
They basically take the bone marrow and hang it like it's blood, and it goes into your system that way.
So what the climax is, basically, you're saying, is finding the match. That's where the tough part is.
That's the tough part. It's a huge tough part, and for a little kid, especially in my daughter's situation, it's after the bone marrow transplant that the kid is actually, in my daughter's case, her levels were so low, she almost lived in a bubble for a year and a half.
Okay, let's talk about that, because I have a question here from a listener who's asking about anti-rejection drugs. So now we're talking about the patient, the ill patient, not the donor, but the donee. So what kind of stress, sickness does a typical bone marrow transplantee experience? Jason, tell us about your daughter.
My daughter had high fevers. My wife never left her side in the hospital. I was going back and forth between Connecticut and Boston, so she could explain it more. But I know she had high temperatures. She had extreme dryness on her skin, like crackling in her skin. That actually bled, so they had to suit that down. Because the chemo and the radiation, she lost her hair, so her immune system was totally off whack. So a common cold could get a high temperature or something like that. She was too young to explain, but she lost her appetite, and a lot of kids say because their mouth tastes like weird, like metallic. And another best way is she rested a lot. She slept a lot. Her energy level was drained for obvious reasons.
Now, let me ask you something, Jason. Was your daughter, for all intents and purposes, eventually cured of the original disease?
For that part, yes. We found out it's actually an underlining situation that she'll have for the rest of her life, so she just has to stay monitored once a year.
Okay.
We still have side effects here and there, and that's normal for some kids, and every person is different.
Okay.
So it's ongoing. That's the best way I can say for a child.
And how old is your daughter now? How many years since this?
She will be turning 6 on April 20th this year.
Oh, that's my birthday too.
Yeah.
You're kidding. Wow.
Yay.
All right, that's a God thing.
Yeah, that's a good luck sign. Good.
Wow.
That's right.
Wow.
And for recovery, it took her like a year and a half to really get back to where she is. And
that's okay.
She's back at school now. And the best way they describe it to me is she's a 6-year-old with a newborn immune system, so she catches all the colds again.
I see.
Right.
I see.
Did she have to get re-immunized again?
She did.
Yeah.
What does that mean?
Again.
Like all the shots that you get as a child, because you're getting
shots. And what people don't also realize is when you get someone's bone marrow, your blood changes. Your blood type changes if it's a different match. So she wasn't O when she was born, and I think now she's like A positive or A.
No, so that tells me something, Jason, which I wouldn't have realized. You're telling me you can have a bone marrow match with a different blood type.
Mm-hmm.
Which I would never have thought intuitively. I would have assumed it would have to be at the minimum the same blood type. So that's interesting.
It happened, yeah.
Well, Jason, God bless you and your daughter. Thank God.
Thank you much.
And stay well, and thank you for calling in and telling us your story.
No problem. Anytime, Lisa. Great show.
Thank you, Jason. That's
okay.
Jason calling. Wow. This is Lisa Wexler, and we are beginning our conversation. We're going to be joined by 2 professionals in the field of bone marrow transplants at 5:30, but we already have Maxine Braten, and you know what? She's pretty much at this point probably a professional amateur, I would guess, and not by her own, you wouldn't have wanted to choose this path. Am I right, Maxine?
No, I would not have wanted to choose this path.
On the line with us is Dr. Michael Barr, her oncologist, hematologist in Stamford. Maxine, can you tell us a little bit about when this condition was first discovered with you and how it was first discovered?
Absolutely. So it's actually a little bit more of a long story. About 6 years ago, I actually have another condition. I have partial seizure disorder, and I was taking a medication that needed to be monitored through blood. And my neurologist found that my blood cells didn't look exactly correct. So she sent me over to see Dr. Barr. And Dr. Barr had watched me for about 2.5 years. And about 1.5 years into our relationship, I'll call it, he decided to do a bone marrow biopsy because he had some suspicions. And at that point in time, he didn't really say too much, but he was like, there's a syndrome called MDS. He goes, you might have it. I'm not sure if you do, but right now we can't fully diagnose it. And then 1 year later, as he watched me continually throughout that year, he saw my numbers were decreasing and took another bone marrow biopsy and said, you do have this syndrome and we need to do something pretty quickly.
Well, is it always something that is fatal? I mean, is it always something that ends in death?
No, actually, I need a bone marrow transplant because not only do I have MDS, but I also have chromosomal defects. So there are 2 chromosomal defects that I have, which is pretty rare, I've been told. Usually there's one or the other, but having both is rare, and that is why I need the transplant.
Because it'll make you well altogether?
Yeah, this is my cure. This is what they've told me, that this will be my cure, and I will live to the ripe old age
that you should live.
Yeah,
that you should live to. We have Jay Feinberg calling in. Is that correct? Is Jay Feinberg on the line? Okay, Jay Feinberg, the executive director. And now Dr. Barr is with us as well. So Dr. Barr and Jay Feinberg, is everyone here?
Yes. Well,
hello.
Hi, I'm here.
Okay, and who was the I'm here?
Here is Michael Barr. I'm Maxine's physician.
Hi, Dr. Barr.
Hi.
Thank you for joining us. And Jay Feinberg, you're here as well?
Yes, I am.
Hi. Okay, thank you for joining us. So let me ask you, Dr. Barr, because we're going to go to a break at 5:30. I'm asking both of you to hold over. So, Dr. Barr, you've been treating Maxine for a while. Can you tell us why it is so imperative from a physician's point of view that she receive a bone marrow transplant?
Right. Well, Maxine has a primary bone marrow disease. So directing therapy at the bone marrow is the key to her success. The problem we have with Maxine is that there is no way to eradicate the underlying malignant cell, which we refer to as the stem cell, the malignant stem cell, without utilizing an aggressive approach such as a bone marrow transplant. If we can wipe out all of the sick cells in Maxine's bone marrow and replace them with good cells from a donor, Maxine will then have the donor's bone marrow function, which will be normal, and she will just go about her business.
Okay, so this represents not merely a treatment, but really a cure.
This is, yes, this is an attempted cure of this particular disease. That's right. This isn't just putting it in remission. This is putting it in remission and keeping it there and curing Maxine.
And the history of this procedure for this disease is a good one?
Yes, it actually is. Now, transplant, particularly this kind of transplant, where a donor who donates marrow to a recipient rather than one where you basically donate to yourself, which is not an appropriate treatment for this particular disease. It's a very complicated situation, and a lot goes into trying to prognosticate how someone will do after this type of transplant. But Maxine has a lot of things in her favor, and because they're in her favor, the outcome, I'm very optimistic that it will be a very good one.